A group of doctors are warning that Canada's healthcare system isn't prepared for the worsening effects of climate change. Now, this is especially considering the ongoing strains from the COVID-19 pandemic. Finola Hackett is a locum physician in southern Alberta and a co author of a policy brief on climate health risk in Canada. Now, Dr. Hackett says ignoring climate related health risks would be costly in terms of both dollars and lives. But taking action now could prevent disease and death. But what exactly are climate change related health risks, and what steps can we take to prevent them? Joining us now to talk more on this is Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Dr. Raut, welcome back to Forum Daily.
Great to be here.
Now, this is really interesting, Dr. Raut. When we think about climate change, we don't necessarily think about its impact on your overall health. So, can you tell us a little bit more about that?
Right. So that's the important thing here. Climate change is now slowly being recognized as probably one of the greatest threats to human health in the 21st century. We're seeing climate-related hazards already affecting the health of many Canadians, and we have a lot of evidence to suggest that that's definitely going to grow. What we're seeing is an increase in morbidity and mortality, and this is linked to a lot of greater frequency and severity of extreme weather events and natural hazards. So extreme heat, floods, wildfires, hurricanes, ice storms, and droughts. We also see that climate change can affect economic livelihoods and mental health. We see a lot of food shortages as well, resulting in a lot of food insecurity. And the people that are most vulnerable to these health impacts tend to be seniors, children, infants, and socially and economically disadvantaged people. And finally, chronic disease and compromised immune systems, indigenous populations tend to be also greater affected.
And just to bring this towards Canada in particular, what kind of health risks do Canadians, or are Canadians risking in terms of climate change?
Right. So we do have some reports, Canada specific. The Lancet report here underscores a little bit of those health risks, pointing to the heat dome that settled over British Columbia, as we know, in the summer of 2021, as a very classic example and a more recent example. That heat dome, which caused about 600 deaths in BC, could have been virtually impossible without the influence of climate change. So we're starting to see those play out as well. Hackett is a physician in Alberta. She also sees a lot of asthma and COPD, which certainly is more prolonged in the air pollution from wildfire smoke as well.
All right, Dr. Rao. Now, advocates are saying that the healthcare system isn't prepared for the worsening situation of climate change. So, what is your take on this?
Right. So I think the healthcare system has a lot of potential to increase that resilience to things like increased heat or floods or climate related health risks at all. But I don't think it's there yet. It's far from ready, especially given the COVID-19 pandemic. What we're seeing instead is that with climate related issues or disasters or catastrophes, we can see an increase in the number of emergency room visits by almost 10 to 15%. So this really causes an added strain right now to the already burdened healthcare capacity, and it does reduce the quality of care we have.
And on that note, can you tell us a little bit more about the current state of our healthcare system, as you said, amid the pandemic and staffing shortages?
Right. So, I mean, no one is surprised that what we're seeing is a shortage on doctors and nurses as well. We've seen that many hospitals across the country have had to even close emergency departments for it. And Statistics Canada is showing that the first quarter of this year, nearly double of the vacancies in healthcare than it was even 2 years ago. I think the stress of the pandemic and the increased workloads has really led to a high rate of burnout and high rates of retirement and exits from the healthcare profession.
All right, Dr. Out, about a little over a minute left here, but let's talk about some solutions. So, what kind of steps can our officials take to prevent a total collapse of the healthcare system due to these climate related health risks?
Right. So what we really need here is to coordinate the transformation of Canada's health system in the one that really keeps in mind climate change. So adaptation measures, which would look at specific climate risk training for healthcare workers and contingency plans for disaster events as well would be very, very helpful here.
And how can individual Canadians prepare for or protect against such health risks?
So what we're seeing in general is that Canadians are understanding more about the risks of climate change to health, which is great. In terms of actual measures, I think what we have to do is we've got to realize that we're still in the early phases here. We need to look at these links that we can do to have some national coordination, and that certainly can only happen when we advocate for it as a country.
All right, Dr. Raut, always an informative interview. Thank you again for your time today.
Thanks so much for having me.
Stay with us. Forum Daily will be right back after the break. And when we return, we're going to be taking a look at more headlines and news stories from across Canada and around the world as the Competition Bureau says it's against the Rogers Shaw merger and students protest tuition hikes in Newfoundland. We'll take a look at these stories and more news from around the world shortly after the break. Stay tuned.